All right, good afternoon, everyone. Happy Friday. Welcome to our media briefing for today. So we're going to have to pivot a little bit. I did send out an email indicating that Dr. Moreno would be joining us, and he will. His time slot has just changed, so he's going to join us a little bit later. So please have your questions ready for him. And thanks for being flexible with me today. We're going to go back to our kind of original topic lineup. So we're going to start with Marjorie Rocha from Echo Housing. Marjorie, thanks for being on the call so early, and thanks for being flexible. And Marjorie's going to tell us more about some webinars that Echo Housing is doing for the county on the eviction moratorium. Hi, Marjorie. If you could unmute, that would be great.
Hi, how are you?
I'm fine, thanks.
Good. I would like to provide you with a little history of Echo Housing. We've kind of just came on the scene about 3 years ago, and people aren't still quite used to us. They don't know what to think about us. And so I'd like to provide you with a little history and then talk a little bit about the webinars, if you don't mind.
Great, thank you.
Great. ECHO's a HUD-approved housing counseling agency, and we're also a designated qualified fair housing enforcement organization. We were founded in 1964 by community volunteers dedicated to equal housing opportunities, and we have a 55-year history of fighting discrimination in housing, fair housing enforcement, and homelessness prevention. ECHO currently has 10 staff members spread out over 6 offices throughout the counties of Alameda, Contra Costa, and Monterey. And our services include fair housing and tenant landlord counseling, rent and deposit grant assistance, shared housing, home seeking, and first-time home buyer counseling. For residents of Monterey, our services include fair housing counseling and investigation, tenant landlord counseling and mediation, pre-purchase counseling, and first-time home buyer education. Emily Garnica is ECHO's housing counselor for Monterey County, and for tenants and landlords that wish to contact her, she can be reached at 831-566-0824 or emily@echofairhousing.org. Emily provides fair housing counseling and investigation for households that experience discrimination based on race, color, religion, national origin, sex, familial status, and disabilities. And also state protected classes such as race, source of income, and marital status. She also provides counseling and mediation to tenants and landlords on issues such as evictions, rent increases, repairs and habitabilities, and other housing rights and responsibilities. ECHO also provides educational webinars for tenants, members of the housing industry, and nonprofit service providers. To go back to what you had originally mentioned, in order to provide information on the current eviction and foreclosure concerns for tenants and property owners impacted by COVID-19, we are having a weekly live webinar on the Monterey County eviction moratorium, which also includes information on the Judicial Council emergency ruling, which has effectively halted evictions until it's lifted, which that may not happen anytime soon. And the Tenant Protections Act of 2019, which provides rent caps and evictions for cause. So basically the rent caps is a form of rent control, and evictions for cause means that you cannot evict a tenant without good cause. These webinars are scheduled on Thursdays at 5:30 p.m. And we'll post them on our events calendar at the ECHO website, and that can be accessed. The web address is www.echofairhousing.org. And we will also be providing webinars on the same topics specifically for the city of Salinas. Their moratorium is a little bit different than the county's, and those webinars will be posted on our events calendar as well.
Great, Marjorie, thank you very much. I do have a question for you. I'm wondering if you could put the phone numbers and the websites that you had mentioned, if we could get them in an email, if you would be able to send them to me. Some of our media partners would like to get that. So
Okay.
after our briefing is done, that would be great. You know, since we've got Marjorie here and we are still waiting for public health to join us, if you have any questions for Marjorie about our programs and the programs that she's working on with us, this would be a good time to ask them. And I'm not seeing any. You've done a great job, Marjorie. You've been extremely thorough.
I must have answered every question.
That's great. And people may, well, here's our from our friends at the Weekly. Have we seen an increase in evictions since COVID-19?
Actually, it's kind of strange. The evictions are different. It hasn't increased, but they're a little bit different. Now they're saying that rather than withholding the rent or not paying the rent, they're attempting to evict them because tenants are creating problems. They are being violent or tearing the place apart. This was never an issue prior to people withholding their rent simply because they can't pay it. They can't afford to pay it. And so the landlords are, if this is indeed happening, the landlords have the burden of proof. They have to prove to the judge that this is a health and safety violation by keeping these tenants in their units. So those are the kinds of things that we're facing now, rather than I'm evicting them because they haven't paid the rent, or I'm evicting them with a 60-day notice because I just don't want them there anymore.
I have another inquiry on this subject. Are there any specific numbers or data on those types of problem evictions?
You know, I'm not prepared to answer that right now because I have to go back and I have to look at those kinds of those evictions. My staff keeps those kinds of statistics, so perhaps I can get them for you.
That would be great. And additionally, is the situation you're describing widespread or in unincorporated areas of Monterey County?
Again, I can't respond to that.
Okay.
I don't have that information.
That's all right. We ask questions. You just never know, right?
Right.
So, and thank you, Marjorie. Somebody may have a question for you that comes to mind if you would stay on the call with us.
Okay.
And
Absolutely.
And now we'd like to invite our library director, Hilary Thayer, to talk with us about curbside services, which are starting, and we're very excited. Hi, Hilary.
Hi, thank you so much for inviting me, and we are so excited to. Starting next week, we are going to be offering our library users the chance to pick up materials they put on hold at their library branch. This will be in addition to all the other ways we can provide service today. We're not taking any of them away. So a limited pilot schedule is going to be tested next week. So those with a hold in the system that they've set to pick up at a branch, they will get a call from that branch. And at that time, we'll share the days, the times, and the procedures that they will need to pick them up. That's being shared from the branch because, as you can imagine, they may work differently branch library to branch library in terms of where we're going to ask people to park and what to expect when they get there. We may not be able to offer this at all branches at once. We have a couple of wrinkles we're still working on ironing out, but anybody can place their hold to set to pick up at their favorite branch, and they will get a call with the details. Library by mail is also still available to everyone. You can place a hold, select your pickup point as library by mail, and we will mail that item to you at your home. So anybody who's unable to get to a branch still wants to significantly shelter in place at home, or the pickup points at the branch are just inconvenient, we can mail their library items. We're also still offering zip books, which is mailing new items. We anticipate all of our book drops will also open next week. We're still not charging any overdue fines at all, but we're definitely getting calls from people eager to return those items, and we anticipate every book drop opening next week as well. So you'd be able to return your items anytime. Everything else is still available. A few data points on our current programs. Lunch at the library started at all libraries last week, and we are handing out over 1,000 meals to kids a week. That's 1,000 free meals to anyone under 18. We have over 350 kids signed up for our summer reading program, and we're mailing them their first free book and their reading log. For library by mail, over 1,500 library items have been mailed by library by mail. Most of those were standing holds that had backed up in the system. So we are catching up, and now we'll see how many holds we have going forward for library by mail versus curbside pickup. And we still stand by to assist via phone, email, and chat. I'll paste this all into the chat for details as well, but our phone number is 831-883-7555. We answer that phone Monday through Saturday from 10 to 6 in both English and Spanish. You can also visit us online at emcfl.org. I do see a couple of library-specific questions. For materials returned, we do have a quarantine procedure before we check them in. So we have a process in-house to pull the items and quarantine them before they get checked in and put back on the shelves and in the system. So we're working very closely with our state level guidance and of course our county level guidance to make sure we're handling all the materials safely. So is there a deadline for children to register for summer reading? They can register anytime at all during the program, which lasts into July, and they can register online via email, via phone, via chat. Just give us a call and we're gonna make sure that kid gets registered and gets a free book in their hands. And I'll paste all these details into the chat as well.
That would be great. There was a question about library by mail, part of which you answered. 1,500 items being mailed is pretty impressive. Do you have any on hold right now? Are you seeing that number going to increase?
It is going to increase. We just made the service available publicly last week. So we are seeing an increase in holds for library by mail as people learn that the service is available to them now and they start placing their holds. We're also calling everyone who places a hold for library by mail. And some of them say, I'm willing to wait for my branch to be open. And some of them say, yes, mail is the only option. Please send me all my items by mail. So I think once curbside pickup comes back, we may see the number of holds fluctuate as people are able to get their items.
Great. And then we talked about it, the curbside things starting next week. Are there specific dates for the drop boxes to be open and the pickup to actually begin?
Some of the branches are calling patrons now to pick up on Saturday. If they have a big bulk of holds and that branch is ready with all their supplies and all their materials, I've given them permission to start calling. Other ones will start calling on Monday for pickup next week. I'm going to announce the book drops are open next week, probably starting Tuesday. I don't want to say they're all open and we have one branch where we could not get there and get them open, but they will start opening very quickly because we have staff more regularly going in to handle the returned materials.
If people want to know, if they've got some things they want to put in the book drop, should they check on social media, check on the branch website to find out when they should come and make that drop?
I would recommend giving us a call. I can say up front, the book drops at Marina and Seaside libraries, which are two of our biggest branches, have been open this whole time simply because they don't lock. So I know those two are open if somebody wants to get the materials out of their hands, and that's convenient. The other ones I would recommend giving us a call, and we can probably get in touch with someone at the branch to know specifically. I hope to announce everything is open next week, and that announcement will go on social media and the website.
Great. Thanks very much, Hilary. That's really great news and fantastic numbers on the summer reading program and the meal and the grab and go meals.
And I will paste all this into the chat and along with my contact information.
Thank you for that. And then thank you both for going early as we awaited Dr. Moreno, who is able to be on the call with us now and give us a public health update. Hi, Dr. Moreno.
Hey, Maya.
Good afternoon.
Yeah, good afternoon, everybody. So, update COVID-19. I would say that on overall, we are, as a county, we continue to see, we're in the pandemic. We're still in the relatively early stages of the pandemic, and we are observing a slow increase in the number of cases that that are occurring here in Monterey County. And as far as cases, we have the last count, 1,156 confirmed cases. On our website, if you follow our data under the hospitalizations, we made it clear that we have 98 hospitalizations. We made it clear that those are cumulative cases. That means that's the total number of people that have been hospitalized for and diagnosed with COVID-19 in Monterey County. That's not the total that are in the hospital right now. We're still at 12 deaths, and we've had over 4,000 close contacts identified, with at least 97% of confirmed cases, 98% of confirmed cases contacted and instructed how to isolate, and about 97.5% of contacts, close contacts, have also been identified. Contacted and instructed how to quarantine. And we continue to assist individuals who can't. The county continues to assist individuals who cannot safely isolate with alternative shelters, sheltering in hotels with support services to help them to finish out their isolation safely. So. Let's see, I would say we continue to look at what appears to be disproportionate representation of COVID-19 among the Latino population and agricultural workers. And we continue as a county and as a community, continue to implement strategies and provide services that are intended to lend support to the entire county, to everyone in the county, but in addition, additional support to individuals who are appear to be more impacted, groups that are more impacted by COVID-19 than other groups. And the last time I spoke with this group, I mentioned several of the things that we are doing. Let's see. I think I haven't pointed this out for a while, but among all the cases thus far in Monterey County, 55% of the cases that we've spoken with, we and the person were able to identify somebody who had COVID-19 that exposed them and caused them to be sick. We, however, have about 43% of COVID cases where neither they nor we could identify a person with confirmed COVID that they were exposed to. And so the reason I want to bring that up again, I haven't brought it up in a couple of weeks, is that it's a reminder that if you stay away from somebody that you know has COVID-19, they're isolating, you stay away from them. That's the best way to not get exposed to COVID-19. But just because if you go out and you're within 6 feet of people out wherever you may be outside of your home, there are people out there who have COVID-19 and they're infectious, and you may get exposed when you go out of your home. So keep that in mind, because 43% of people could not identify who exposed them. So it's out there. Even if people aren't coughing and don't look ill, it's out there and you could still get exposed. As far as testing, we continue to increase our efforts to expand testing. Maya, is Gary Gray on the call today?
He is not on the call today.
Okay, anyone from NMC?
They are not scheduled, and
Okay, thanks. All right, thanks. So I'll just add that Dr. Gray mentioned in a conversation we had that the hospital provided testing out in Seaside, and we're all very grateful for that. As I've mentioned in the past, just recently, the data that we have now, we have more data to analyze, and we can see that the Seaside area is an area where there's a need we have lower testing rates. And so bringing testing to the Seaside area is a tremendous, I think, benefit to the residents of Seaside. For those who want to get tested, it makes it more convenient for them to get tested, and helps distribute testing availability to parts of the county that up until now seem to have less utilization of testing. So that's also very appreciated. We also have, we continue to have overall 6.6% test positivity rate, but that's since we started testing, but that's been more or less consistent. And that's it. I would, let's see. Well, I'll stop there, Maya, thanks.
Well, Dr. Moreno, did you want to address the face covering order?
Sure, I'll be happy to, Maya. So the Monterey County is currently under my local health officer order for face coverings, and that requires people over the age of 13 and older to wear a face covering with certain exceptions. And the intent there is to make best use of evidence that shows that when we cover that people are contagious, can be contagious if they're infected with COVID-19 before they develop any symptoms, and some people never develop symptoms and are infectious. And so, so with that evidence, the face covering order that we have here in Monterey County is intended to take advantage of that information to, and in requiring people to cover their face, we're actually protecting each other from potential exposure to COVID-19 when we're out and about and near going to places where people from other households are there. So that's the stores, restaurants, work. So the health officer order from the state, or the guidance that came up from the state, requires that all Californians cover their face, and similarly. And that provides statewide guidance for anyone that's in California, whether you're a resident or visiting. That also takes advantage of the evidence that shows that covering the face can slow the spread of decrease exposure, which continues to slow the spread of COVID-19, which means that our hospitals hopefully will not get overburdened, and means that the hospitals will have the resources and the staffing to care for any one of us should we become ill with COVID-19. So covering our faces helps to make sure that healthcare will be there for us when we need it. So my order doesn't require individuals under the age of 12 or under to cover face. Doesn't require them to have their faces covered. The state health officer order does, so that's one difference. But I think the really important thing for people to know is that just get back to what's the intent of covering our faces. So I think it is important for everyone to cover their face if they can. And I would say if a parent wants to have their child cover their face while they're out in outside their household, I just ask that parents do so safely, and help their child put it on safely and take it off safely, and remind their child as much as possible to try not to touch their mask or touch their face while they're wearing their face mask, and use common sense. If the child is really struggling with it, or using it in a way that parent doesn't think is safe, then parents need to do use some common sense and do what they think is right for the child, particularly in the very young children.
Right. Thanks, Dr. Moreno. And then we'll go ahead and start with the questions that we have for you. For people who have been tested for COVID-19 multiple times with different results, what are they supposed to believe? This reporter said that they had a viewer reach out to them about receiving contradicting test results. So their questions are, is it common to have a false positive?
Well, I'll try to answer that last question. Is it possible to have a false positive? There are different types of tests that are out there. I'll try to address the various tests, not knowing which test the individual was which test the individual was talking about. So the most common test is a test to actually look for the virus itself, and it starts off with a specimen being collected from the nose onto a swab and sent to one of a variety of laboratories to look for the virus through polymerase chain reaction methodologies. If someone tests positive, then we follow public health guidance, which is that person is presumed to be positive. And if that person has symptoms, then that person is quarantined in isolation for at least 10 days from the onset of symptoms. And if a person doesn't have any symptoms and test positive, then that person is in isolation for 10 days from the date that they tested positive. So that's the public health guidance. There are also serology tests, and what I'm looking into is whether some of our hospitals might be actually performing the test that is specific to COVID-19. As we move forward and the industry, the research and pharmaceutical and health industry and health sectors make advancements in testing for antibodies, specific antibodies for COVID-19 are going to slowly become more available. So I don't know that the person who asked the questions about antibodies, because hardly anyone's getting antibody testing, not in comparison to viral testing. So most likely the viral testing the person's talking about. So as far as false positives, that was finally get so that's a little background, and then false positives. At this point, there's no public health guidance that's to suggest that a person who tests positive with the PCR test is falsely positive. The tests are sensitive, which means that if a person has COVID-19 and they test positive, it's a very high likelihood that the person actually has COVID, has the virus, has had the infection, and it's very unlikely that a person had a false positive test if it's run with PCR. But I can't really talk to false positive or false negative rates with serology testing at this point, because we don't have much information on those tests. Yeah.
Thank you. And then just the last question in this series, if people have symptoms but have tested negative for COVID-19, what should they do?
Oh, yeah, great question. So if someone thinks they have COVID-19 and they test negative, that person should consult with their healthcare provider, because their healthcare provider can make a clinical assessment of the patient, and that's important. My responsibility is to care for the health of the public, Monterey County, and anyone living in Monterey County. Clinician's responsibility is for the care of that individual patient. So if someone has symptoms and tests negative, they really should check with their healthcare provider, because the healthcare provider may make a determination that, well, you have all the classic symptoms of COVID-19, but you tested negative. It may have been because you had, and the clinician may say, I think you have COVID-19. Maybe we didn't swab you correctly. Maybe we didn't leave the swab in there long enough. And it didn't test positive, or maybe you're so far into your illness that we can't detect the virus anymore, but you have all the classic symptoms. The healthcare provider can make a recommendation as to whether that person should follow isolation orders. So that's my recommendation. If someone's got symptoms, they should definitely call their healthcare provider.
All right, thanks very much. Moving on to other questions. With the governor requiring Californians to wear masks in most settings outside the home, how would you, Dr. Moreno, deal with this? And will there be enforcement? Particularly curious how this will be communicated to out-of-state visitors.
So thank you for the question. I may have answered some of it before, but I'll provide another response. So now we have a state order and a local order for face coverings, and the intent there is for, again, to take advantage of evidence as evidence. More evidence becomes available to us. It can help inform decisions, and so the state health officer believed that she had enough evidence available that shows that covering our face can prevent exposures and slow the spread of the virus here in California. So the requirement to cover faces are still applicable here in Monterey County, and people should cover their face with a few exceptions, should cover their face when they're outside their household, so that we can continue to take advantage of businesses that have reopened with modifications, activities that are slowly being allowed, take advantage of the fact that schools are planning to open their classrooms again. And if we want to send our kids to school, if we want to continue to go get our hair cut, if we want to continue to be able to dine and go to stores and to make purchases, we're going to have to all work together to slow the spread of this virus, because if we don't slow the spread of this virus, we could see a sharp rise in cases that overwhelms the healthcare system. And we would have to start looking at taking those, closing schools again, sending kids back home to distance learn, and other measures. So I hope we don't get to that point. I hope that people in California and in Monterey County continue to cover their face. If they're not covering their face now, they should start covering their face. If they want to, if they've got kids and they plan to send their kids to school this fall, they should start covering their face now. In terms of enforcement, there's different ways that the face covering order can be enforced. One is through the businesses. The businesses are allowed to reopen with modifications, and those modifications are aligned with the state guidance and any guidance that we may have issued locally. But the state guidance for the business sectors have requirements for face coverings, and so enforcement is part, or I won't say enforcement. I'll say why don't we just say assuring that people cover their face as required is a community effort. So the businesses, the owners, store owners, shop owners, business owners, their management, supervisors in the organization, and the employees themselves play a role in making sure that face coverings are worn in accordance with local and state requirements. And so that's one way to ensure that people are covering their face. Another way is that people who want to go to these businesses that have reopened should cover their face and comply, be respectful and comply with the efforts of the businesses to have people in the stores cover their face. So it's in part everyone that wants to go out of our house to seek services. And so that's another way that it can be reinforced. And then, of course, there's the cities, the local incorporated cities and communities with the opportunity to work with any permitted or licensed businesses to also remind them to abide with requirements for face coverings in those settings as well. So there's a variety of ways that this we can, as a community, make sure that we have high compliance with face covering orders. Did I answer all the questions in that?
Yes, I think you did. And for those that are wondering about tourism communication,
Oh, yes.
the MCCVB is working on tourism information, and certainly our media partners could check in with them about their plans for that.
Yeah.
So I'll move on to the next question. We don't have anyone on the call today from Natividad, but I have a question about the next pop-up testing site in South Monterey County, and I will forward your question to Natividad and see if they have a new date or a plan for that. Then moving on, for Dr. Moreno, with cities having to enforce masks, sometimes with, or wearing face coverings or masks, sometimes with fines, is there a legal way they're able to bypass the process of introduction, first readings, second readings, etc., or will those enforcement efforts have to wait for proper ordinance timing being put into place?
Yeah. So, man, that's not my specialty. So
Right.
maybe there's another department that we could forward that question to.
And that might be a specific, a question specific to each individual community. I'll work on this one, and we'll move on to some of our next answerable questions. Since state face covering requirements appear to include everyone over age 2, so is the county okay with that? How would that be enforced, and what impact could that have on schools when they reopen?
Okay, so I think there's two questions in there. One is how do we assure that that kids cover their face, and then how does it impact schools? So I think it's, again, we get back to what the intent is of the state and the local order, and that is, again, to try to slow the transmission of disease in a safe manner. So I would just say that if parents want to, in Monterey County, not parents who are in Monterey County with kids want to cover their child's face, if they'll just have to, they know their child best if they consider the age of the child, their physical, emotional, and cognitive development, and decide whether or not their child can safely wear a face covering. Then by all means, parents can put face covering on their child even if they're 12 or under. So yeah, I mean, there's a lot of kids under the age of 12 who would be very compliant with it, and it would be appropriate and not wouldn't pose any danger to some children. So I do want to point out that the children 2 and under shouldn't be wearing face coverings because they're not, again, emotionally, physically, cognitively developed enough to be able to wear a face covering safely. So, and especially babies, face covering is not recommended whatsoever because we are trying to, in infants, we do not cover the face, and so that shouldn't be happening. I'm sorry, what was the second question, Maya?
The other part of the question was how this face covering requirement could impact schools.
Oh yeah, schools, thanks. Yeah, so I have meetings with school superintendents once or twice a week as they work through the guidance from the state to try to understand what the guidance means and what options they have to them. So we will have this, and they're in the planning process. So I believe they want to start August 1st So they've got many of the plans, I believe, are well underway, and the superintendents, I'm sure, will have questions for me, and it will depend on the circumstances that each school is under, in figuring out how to comply with all the guidance that's coming from the state for them to reopen, in addition to face covering requirements. So we'll definitely be having that. I'm sure that they're going to put that on the agenda. So I'll be working with them.
Thank you very much. And this is a question, we've had this question before, but it's always a good reminder for everyone. Will there be more information released about COVID-19 deaths, such as age, sex, and if they had underlying conditions?
Right. So yeah, I think we have had it recently, and again, it's anytime that we take demographic information and separate it, we have to have at least 5 events, in this case deaths, within a particular category, for example, an age group or race, ethnicity, or occupation, just to name a few. And so with only 12 events, or in this case, 12 deaths, it's we don't have enough numbers to be able to start breaking those out. So we're treating the deaths as we've treated all the other information, the cases most notably. And when we get to 5 and we have enough, not just the 5, but we have enough in the remaining that we can somehow make 2 categories that make sense, then we can begin to think about whether we can break that out. So with only 12 cases, it may not be able to break that out for a while, and I hope we don't for a while, which means if we can stay around 12 or 13 for a while, I mean, that would be a good sign that we're actually doing a good job in keeping slowing the spread of disease, Maya.
Thanks very much. Our next question, Dr. Moreno, was opening up expanded personal care services something you were more reluctant to do than other business sectors? Do you have a similar reluctance now given the amount of cases that have been popping up in Monterey County?
So I don't know that I was reluctant to open those. The approach that we use is more based on what we know about the spread of disease, and based on what we know about the spread of disease, we can determine what are lower risk activities and then low and then somewhat higher risk activities. So we moved from regardless of the risk, we started with just essential services. We knew that our community needed to provide certain services, and people needed to receive those services. So regardless of the risk, we kept essential services open. And then we moved into the next stage where we looked at the lower risk activities and started to allow lower risk activities that weren't necessarily essential for the community, but provided a benefit to our economy by allowing people to get back to work or to increase the number of hours that they work. And so as we look at the variety of businesses and activities that are out there, as we open up the lower risk activities, start moving into risk activities that have higher risk. And so it's really on as much as possible, we opened up, we're reopening businesses based on risk for exposure. And so there are services that weren't essential that would bring people within 6 feet for at least 15 minutes, which actually is, if one person has COVID-19, that meets the criteria for close contact. So those services are typically personal services where one person is providing a service to another person and they have to touch the other person or come in within 6 feet for a long period of time. So the hair salons and barbershops were opened as part of that group. They were the first of the somewhat higher risk businesses to open first. And now we're opening up additional services that are similar in that there's close contact with for 15 minutes and touching of the person providing service touching the client. So we are allowing higher risk activities to occur. And that's part of a strategy to reopen services and businesses with modifications. And as long as we as a community, as long as businesses adhere to, and the customers adhere to the physical distancing as much as possible, wearing face coverings, washing your hands frequently, as long as the business continue to clean and disinfect adequately and appropriately, and that would help to slow the spread of virus. And if we continue, the governor may decide to reopen other services.
All right, thank you very much, Dr. Moreno. I have a question here regarding agriculture worker housing. I don't have anyone on the call that can address that, but I can forward that question for the reporter who asked, and we can see if we can get a response for you. Moving on, the latest county update shows only 196 tests in the last day. Is this a bad sign or an isolated lull?
Maya, the way we've been requested to post data as it comes in, and as data comes in, we collect it and we post it to the website. So tests that come in, we don't control when the test results come into us. That's up to the laboratories. So if laboratories hold on to, if several laboratories hold on to test results for 1 or 2 days, and then they send them all to us at the same time, and we get 500 tests all in one day, it doesn't mean that people were sick. 500 people got sick on that day. It just means that we received 500 test results. But if everyone sends their test results in right away, and then the number will every day, and there's no delay in reporting to us, then the test results, number of test results will be lower than that, and there'll be more consistency in the test results. So when we get increases when we report on the most recent test results for the most recent day, it doesn't mean that that's the number of people who got sick that day.
All right, thank you for that. And then our last question in chat at this point is, can you clarify if indoor gyms must have visitors wear masks while exercising? The order makes mention of outdoor exercising, but not indoor.
So the gyms and people and the members that go to the gym to use the services do have to abide by the industry guidance for gyms, which requires face covering. So that's the standard by which the gyms have to abide by.
Great, thank you very much.
There was something about outdoors, Maya?
Yes, the question was, there was a difference with the order allows, let me get back to, the order makes mention of outdoor exercising in relation to mask wearing, but not indoor mask wearing in exercising.
Yeah, I think they have to abide by the industry standards. Did I not adequately answer the number of test reports, Maya?
No, I think you explained. Okay. That one.
Yeah. So I guess I didn't. The one I can clarify just a little more, Maya. So
yes, please.
I gave the hypothetical that all the commercial labs for some reason couldn't get the results to us, and so they report to us. They may be sending us 2 or 3 days worth of results in one day, and if that happens, then the following day we'll have a lot fewer test results to report because we got a lot in one day, and so it'll look like it went down, but it's just, again, it's just based on when laboratories send their results to us to determine the number of cases. If someone is interested in knowing when people are actually getting sick with COVID-19, that's the graph in our on our website that shows the number of cases by date of onset. So that is probably, that's more, that's a better describes COVID activity from day to day than the reporting by receipt of test. So if you're interested, I would suggest you look at the, people also look at the number by date of onset. And keep in mind, though, that that's also reported, and date of onset is dependent upon what people tell us when we talk to them. Depends on what day they think they develop symptoms. And as we continue our contact investigations, sometimes the information changes. So we may have 25 people with a date of onset posted on a given day, and then a day or two later, that day has 23 or 22 or 28, and it changes because people, as case investigations go, information that we receive can have us change the date of onset, and that's just that's how we do that. So one more thing is just to running out of time, ma'am, but the when we post on a daily basis, that data for the last week or so hasn't been entirely what we call epidemiology cleaned up. It's changing and we change it because we want to have the most accurate data. So we'll go ahead and change it. So it looks like things are changing, but and it is because we're getting more information and we're making the data more reliable. What we typically do in epidemiology is we usually give ourselves sometimes months, because it can take quite a while to totally clean up the data to make it as accurate as possible. And then we usually issue reports, and generally we stick with those numbers. But because we're reporting on a day-to-day basis, the public can expect for some of the numbers to change over time.
Thank you. And thanks for kind of going into a little more detail on that and answering that question. That is all the questions that I have at this point on chat. Is there anyone who has an additional question? We've got about 5 minutes if there is any remaining. Hearing nothing and seeing nothing come in. That will end our media briefing for today. Thanks very much for joining us. Have a nice weekend.
Thank you, ma'am.
Thank you.